You go? Hello, my name is Kendra SOT, and I'm going to be doing the 8 preliminary steps for SOT. The first step is distortion analysis. I'm going to have my patient stand over here and face sideways. I'm going to sit down, and I'm going to have my thumb on their acromion, and I'm going to have them have their arms at their side, and close your eyes, please. And I'm going to be looking for A to P sway, and if he has this, then that'll be a category 1. Have you turn around, face the wall. And I'm going to be, or my thumb's going to be on their S2 tubercle. I'm going to be close your eyes, arms at your side. And I'm going to be looking for side to side sway. And if there is this, then he'll be a category 2. And for category 3, I'll be checking for antalgic lean. And he has none of this. So the second step, I'm going to have my patient sit down. I'm going to be palpating the first rib, the tubercles on the back. Okay, I'm going to have my patient flex and extend, and flex and extend. Category 1, I would feel bilateral movement of the rib heads. Category 2, I would feel unilateral rib head movement, and then in category 3, I would feel neither of them move. Now I'm going to do cervical indicators, so if you would lay down, face up please. And here I'm just going to be feeling the spinous processes of the cervical spine and the TVPs of the cervical spine. And I'm going to ask my patient if there's any tenderness. And a category 1, there would be bilateral tenderness at C3. And category 2, there would be left lamina tenderness at C4. And then in category 3, there would be tenderness all over the cervical spine. And if it was on the spinous process, then that would mean TVP in the lumbar spine would be inferior. And if it was a tenderness on the TVP in the cervical spine, it would be lumbar rotation. Now I'm going to do cervical compaction. And this is used to rule out primary cervical issues. And so first I'm going to lift my patient's head and ask them to put their legs together, their feet together, and lift your legs up. Okay, and now I'm going to compact the cervical spine as I lift up. And I'm going to ask them to lift it up, okay? If it was easier for them to lift up their legs while I compacted the cervical spine, that would mean that there is a primary cervical subluxation. And to clear this out, to correct this, I'm going to use the cervical stair step. I'm going to compact and go through the 4 steps. And they should feel clunky and not smooth. And so if there is a smooth area, then I will fix it with the figure 8. So I do a cervical 8 motion to fix it on whichever step was smooth. And if it was smooth on C7 T8 step, which is the first step, I would use an anterior thoracic adjustment to fix that. Now I'm going to do a basic 1. Okay, so I'm going to place my 8 fingers lateral to the EOP and just inferior to the superior nuchal line. And I'm going to be feeling for pulsations, and I'm going to wait until they're all even pulsations and all 8 fingertips. And this could take 30 seconds to a minute. Okay. And now, and that's going to be for category 1. And I'm going to do basic 3. And I'm going to palpate the sagittal suture to feel for bumps and lumps, or ask the patient if they have tenderness. And then if I find a bump, I'm going to cross my thumbs and then put my fingertips on the parietal ridge. And I'm going to do this for 3 respirations. And on his exhalation, I'm going to traction laterally with my thumbs and superiorly with my fingers. And go ahead and inhale and exhale. Okay. Now I'm going to do the psoas. I'm going to have my patient de-artifact. And this is for a category 2. No belts on, okay. It doesn't matter actually. Okay, let me see your hands.
When you do this, make sure you do a knife edge.
Okay, and then knife edge.
That one knee. Ticklish.
Oh. Oh, you're ticklish. Okay. Okay, I'm going to superiorly traction their arms and put their palms together and see if there's any. I'm looking for the short hand, and maybe his left hand's a little bit shorter than the right. And I'm going to have my patient bend their knee. I'm going to be on the contralateral side. I'm going to place my hand through the knee and stabilize the ilium. Is that okay? And then I'm going to find the psoas belly. You just want me to do that? And I'm going to have you breathe in and out. And every time they breathe out, I'm going to push into the psoas. And then the third time, I'm going to break up the adhesions by frictioning back and forth. And now I'm going to do the anterior iliofemoral ligament test. I'm going to grab their legs and internally rotate the feet and see which one cannot internally rotate. The normal is about 45 degrees. Because they're both kind of bad, but I think that one was worse. It's the right one. I'm going to get on the contralateral side. I'm going to go to find the trochanter and be posterior and superior to that. Use both hands. I'm going to have you internally rotate your leg, and as I pull up, externally rotate. We're going to do this 3 times. So do it one more time, like this, and then the third time we're going to do it fast. So I'm going to count to 3, and fast. Or quickly externally rotate. 1, 2, 3. Okay. Now I'm going to do the arm facet test. I'm going to have my patient de-artifact, no belts or watches. And this is a definitive test for category 2. And I'm going to have my patient just lift up one of their arms, please. And this arm down. Lift up one of your arms, soft fist, palm in. And I'm going to say hold. Okay, let's pretest for that. It's pretty good. And let's do this side. Alright, that's good. Okay, so now I'm going to have you find your umbilicus with the other hand and hold this hand up. Okay, is it okay if I palpate your inguinal ligament? Okay, so I'm going to place 4 fingers on the top of his inguinal ligament. And so I'm going to tell him to hold. I'm going to touch and pull. Okay, and now I'm going to go down to the bottom one. Say hold, touch, pull. Okay, and I'm going to do this on the other side. Find your umbilicus with your other hand. Arm up. And hold, touch, pull. Okay, I'm going to go down to the bottom one. Hold, touch, pull. Okay. And that's for category 2.